The smell of antiseptic never fully covers the other smells. That's what nobody tells you before you take a hospital job. Beneath the bleach and the isopropyl alcohol, beneath the lavender hand lotion that the day shift nurses apply obsessively to combat the dryness, there is always something older and more honest underneath. Copper. Fear, sweat. The particular sour note of a body working too hard to stay alive. Tate learned that on her first week at Lakeview Regional Medical Center in Dayton, Ohio, and 14 months later, it still hit her the same way every time she pushed through the ambulance bay doors at the start of her shift. A cold, familiar punch that settled somewhere behind her sternum and didn't leave. She'd taken worse punches. She'd taken them literally. She didn't talk about that here. The night shift started at 11. By 11:45, Tate had already changed 2 wound dressings, restarted a blown IV on a woman in Bay 6 who had been waiting since 7 p.m., and quietly repositioned a confused elderly man who'd been left sitting upright in a way that would have given him a pressure sore by morning. She did all of it without being asked. She did it without saying much of anything. That was how she operated, moving through the department like something that had been in the water a long time, calm and precise and nearly invisible. Nguyen caught her coming out of Bay 6 and fell into step beside her, clipboard tucked under his arm. He was the charge nurse on nights, a compact, efficient man in his mid-40s who wore his authority lightly and his disapproval heavily. Tate, he didn't look at her. Dr. Forsyth wants the trauma team briefing before midnight. Said he specifically asked you not to be late last time. I wasn't late last time. He said you were. She didn't argue. She'd been 30 seconds behind the others because she'd stopped to suction an airway on a patient nobody else had noticed was desaturating, but Forsyth had been standing at the head of the table by then, already performing for the residents, and he'd given her the look, the slow, condescending scan from her sneakers to her face that she had cataloged and filed away without reaction. She was very good at filing things away without reaction. "I'll be there," she said. Nguyen nodded, then paused. He looked at her sideways with the hesitant expression of someone about to say something they weren't sure they should. He also said, "And I'm just passing this along, that you should consider being more vocal during patient assessments, more collaborative." He paused. His word. Tate looked at the wall for a moment. The paint was a color someone had probably called warm beige in a catalog, and that, in reality, looked like the inside of a cardboard box. "I'll consider it," she said. She walked to the break room, poured herself half a cup of coffee that had been sitting since 9, and stood at the counter with her back to the door, drinking it in 4 even swallows. Her hands were still. They were always still. It was something she'd trained into them so long ago that the training had become the person, and she couldn't always tell where one ended and the other began. Dr. Forsyth was technically competent. She'd decided that early on because she needed to be fair about it, and fairness was something she'd been raised to take seriously. He knew his protocols. He could manage a standard trauma with efficiency. He presented well, tall, broad-shouldered, with the kind of easy authority that came from never having had to fight for a room's attention. People turned toward him automatically the way sunflowers turn toward light, and he knew it, and he enjoyed it, and that enjoyment had calcified over the years into something that looked a lot like contempt for anyone who operated differently. He didn't like Tate because Tate didn't perform. The residents liked performance. The nurses who advanced fastest in Forsyth's ER were the ones who asked questions loudly, who called out assessments in clear declarative sentences, who used his name when they agreed with him. Tate gave her assessments directly to whichever doctor needed the information, at the lowest volume necessary for them to hear it, and then she went and did the next thing. It drove him insane. "She moves like she's already checked out," she'd heard him tell the evening charge nurse, Dr. Kwan, 2 weeks ago through the cracked door of the supply closet. "I need people who are present. She's present in body, maybe. Somewhere else in her head." Kwan had murmured something non-committal. "I'm serious," Forsythe had continued. If she's going to work in my ER, she needs to show me she can function as part of a team, not just float around doing her own thing and expecting applause for it. Tate had taken a package of sterile gauze from the shelf, quietly closed the supply closet door from the outside, and gone back to her patients. She thought about Kandahar sometimes, at moments like these. Not the violent parts. She thought about the particular quality of focus that a forward operating base produced, the way everyone knew their job so completely that they didn't need to narrate it, the way communication compressed into fragments and gestures and trust. She'd worked with men who could hand her what she needed before she asked for it, because they'd been in enough situations together that her body language was a language they could read. The ER was the opposite of that. The ER was theater, and she was, apparently, a bad actress. The briefing was fine. She stood at the back of the room and listened. Forsythe presented a rundown of expected overnight traffic. A pharmaceutical conference in town meant elevated alcohol-related incidents. A winter weather advisory meant potential MVAs. He used phrases like optimal patient flow and collaborative triage approach. She watched the residents nod. Tate, he looked at her directly at the end. Anything to add? It was a test, she understood. He wanted her to either embarrass herself with something inadequate or humiliate herself by staying quiet. No, she said. He smiled with the corners of his mouth. Great. Let's have a good night. The MVA started at 1:15. Two of them within 20 minutes of each other, a black ice patch on Route 35 that was apparently collecting cars like a debt. The first was a teenager, scared and intact, with a possible cervical injury that Tate immobilized while Forsythe talked over her to a resident. The second was older, a woman in her 60s with facial lacerations and a radius fracture and the stunned, distant look of someone whose nervous system hadn't caught up to the event yet. Tate had her settled and assessed before the radiology order was even in. It was during the third hour of the shift, during the brief lull that always followed the first wave of intakes, that she was sitting at the charting station entering notes when Jordan, one of the newer nurses, slid into the seat next to her. Jordan was 24 and enthusiastic in a way that hadn't yet been worn smooth. She was also, Tate had observed, genuinely kind, which was rarer than competence and more valuable. "Can I ask you something?" Jordan said, keeping her voice low. "Sure." "How do you stay so calm? Like during that second MVA patient when Forsythe called the wrong medication dose for the sedation and you said the adjusted dose for her weight is 2.5 and he corrected himself without even pausing and everyone just moved on. How did you do that without your hands shaking?" Tate looked at her. "Practice," she said. Jordan studied her for a moment. "Where did you come from?" "Before here, I mean." Tate looked back at her screen. "Various places." Jordan seemed to understand this was the end of the topic. She was perceptive like that. "Okay. Well, for what it's worth, I think you're really good at this." She paused. "Forsythe's going to make your life difficult." "I know. He does it to anyone who makes him feel." Jordan hesitated. Uncertain. "It's not about you, really." "I know that too," Tate said. She finished her charting. Jordan had moved on to check on a patient. The monitors beeped their random percussion and the fluorescent lights did their flat, colorless work, and somewhere down the hall someone was coughing with a persistence that suggested they'd been doing it for weeks and had finally come in because they couldn't do it anymore. It was a normal night. It stopped being normal at 3:47. There was no siren. The warning was a vibration, not the rolling concussive vibration of something structural, not an earthquake, but the rhythmic, deliberate thwump of rotors. Heavy rotors, the kind with enough displacement to rattle the windows on the south-facing side of the building before the aircraft was even visible. Tate stood up from the charting station. Her heart rate didn't accelerate. It did something different. It steadied, dropping to a slow, deliberate cadence that she recognized the way you recognize a language you grew up speaking. The rest of the room went the other direction. The monitors suddenly seemed louder. A charge nurse across the room dropped her phone. Forsyth came out of a curtained bay looking confused, and then the emergency radio at the main desk erupted. Lakeview Regional. This is Night Stalker 7, Army Medevac, inbound to your helipad with one urgent surgical, requesting trauma team to the pad. Over. Nguyen snatched the radio. Night Stalker 7, Lakeview, confirm. We are not a military trauma facility. Over. Lakeview, we know. Closest facility to the incident. Our surgeon is occupied with the second patient. We need your team. Over. ETA 90 seconds. Copy, Night Stalker 7, team en route. What followed was the specific chaos that Tate had learned to move through the way a river moves through stone. Not against it, not around it, but as a constituent part of it. Forsyth was pulling on gloves, already talking fast, already in performance mode, his voice rising to fill the space that urgency required. Residents scrambled. A gurney rattled past. The rooftop elevator doors were already being held open. Tate was already moving. She got to the helipad level ahead of the others because she'd taken the stairs. The roof was cold, the winter air biting through her scrubs instantly, the rotor wash hitting her like a wall when the Black Hawk, not a medevac variant, something tactical, the windows narrow and dark, settled onto the pad with a precision that spoke of 10,000 hours in the seat. The side door came open before the skids were fully down. 2 soldiers in full kit were out first, boots hitting the pad, and then they were extracting the litter. A man, broad-shouldered even in his current state, his uniform soaked dark from the right shoulder down. His face was the color of old chalk. His breathing was audible from 8 feet away, a wet, labored pull that told Tate his right lung wasn't participating. She was at the litter before Forsyth reached the rooftop door. Hemopneumothorax, the taller soldier said without preamble, looking at her with the flat directness of someone accustomed to delivering reports. Gunshot wound, right thorax, entry only, no exit. We packed it on the bird. BP was 60 over palp 20 minutes ago. We pushed a liter of saline. Last BP was 74 over 40. SAT was 82 on 15 liters. How long ago did it happen? 40 minutes. Was he conscious at the wound site? Yes. GCS on extraction? 12. She had her stethoscope on his chest before the second word was out. Left side, breath sounds, decreased but present. Right side, nothing. Not diminished, nothing. The trachea was midline for now, but the neck veins were beginning to distend. Tension pneumothorax. Developing, not yet complete. Minutes, not seconds. Forsyth came through the rooftop door with 2 residents and a nurse pushing a crash cart. He took in the scene, the soldiers, the patient, Tate already at the litter, and moved to the other side. What do we have? He reached for the field dressing over the entry wound. Don't pull that, Tate said without looking up. She was watching the patient's neck. Occlusive dressing. You break the seal. Air enters. Forsyth paused. He looked at her with the expression he reserved for protocol violations. I'm the attending physician. He's tensioning, Tate said. Right chest, no breath sounds, neck veins up. He needs decompression now, not in the bay. A beat of silence. The rotors were winding down. The cold pressed in from all sides. That is a significant procedure to perform on a rooftop. It's a 14-gauge needle in 30 seconds, Tate said. He doesn't have the time for the elevator. The taller soldier, his name tape read Cardozo, looked at Forsyth. There was nothing threatening in his expression. It was something quieter and more absolute than that. It was the look of a man who had already made his calculation and was simply waiting to see if the civilian doctor would make the right one. Forsyth looked at the patient. He looked at the SAT probe Jordan had just clipped to the patient's finger, 78%. Dropping. Do it, Forsyth said. Tate already had the needle in her hand. She'd pulled it from the crash cart kit while they were talking. She found the landmark, second intercostal space. mid-clavicular line, with the certainty of someone for whom this was not a textbook exercise. She advanced the needle. The hiss of escaping air was immediate and unmistakable, a long pressurized release that felt, in the cold night air, like something unclenching. The sap probe began to climb. 78, 81, 85. The patient's breathing changed. The labored wet pull became something deeper and less desperate. "Get him downstairs," Tate said. "He needs a chest tube and surgery to find the bleeder. Let's move." They moved. In the elevator, nobody spoke. The two soldiers had folded themselves into the corners to make room for the gurney, and they stood with the particular stillness of people trained to occupy as little space as possible. Cardozo watched the sat monitor with the focused patience of someone who had watched a great many monitors. Forsyth stood to Tate's left. She could feel him processing. The elevator opened into the ER and the team took the gurney at a controlled run. Tate called orders as she moved. Chest tube setup, type and cross, blood bank to release 2 units. Oneg, thoracic surgery on call paged. The words came out flat and sequential and correct, and the nurses who heard them moved, because the voice that carried them was the kind of voice that people moved for without being entirely sure why. In Trauma Bay 1, she placed the chest tube in 3 minutes and 40 seconds. It was a clean insertion, correct angle, no false pass, and when the drainage began, dark blood moving into the collection canister in a slow, steady stream, the patient's pressure began to recover. 74/40 became 86/50 became 92/60. Forsyth stood at the foot of the bed. He had not touched the patient since they'd come downstairs. Cardozo had come in despite hospital security's half-hearted attempt to direct him to the waiting area. He stood at the glass doors of the bay, watching. "Who is he?" Jordan asked quietly, appearing at Tate's elbow. "Cardozo, first sergeant." "Not him, the patient." Tate checked the drainage. "Still moving but slowing. Good sign. His name is Devlin. He's 26. She paused. "He's one of ours." Jordan blinked. "Yours?" The thoracic surgeon arrived at 12 minutes, a compact, focused woman named Dr. Osei, who took one look at the setup and said, "Good tube placement," with the brisk approval of someone who had seen too many bad ones to take good ones for granted. She spoke directly to Tate about the trajectory of the injury, and Tate answered with the same precision, and neither of them noticed Forsyth's expression until he spoke. "Tate." His voice was careful, controlled. "Can I see you outside for a moment?" The hallway outside the bay. The fluorescent lights. The warm beige walls. "You overstepped," Forsyth said. He kept his voice low. "On the roof. You countermanded me in front of a patient and military personnel. That is a direct violation of chain of command in this department, and I will not." "He's alive," Tate said. "That is not the..." His saturation was 78 and dropping. Every 30 seconds you waited was potentially a fatal cardiac event. The procedure was indicated. I was trained to perform it, and I performed it. You are a nurse. He said it the way people sometimes said things they believed would end conversations. You are not a physician. You do not have surgical privileges in this department. She looked at him. She looked at him for a long moment, and whatever was in her face in that moment, it was not anger exactly, and it was not contempt, though it carried the weight of both, made him shift his stance. "I was a Special Forces 18 Delta medical sergeant," she said quietly, "for 9 years. I've placed more chest tubes than you've ordered. I've managed mass casualty events in places where your protocols were a luxury we didn't have. I didn't tell you that because it's not relevant to my work here. It became relevant on that roof." Forsyth's mouth opened. Nothing came out. "If you want to file a report, file it," she said. "I'll cooperate with any review. But I'd like to go back in now, because the bleeder they're going to find is probably the intercostal artery, and Dr. Osei is going to want the field assessment from the injury site." She turned and went back in. Cardozo was still at the glass. He looked at her as she passed him, and she gave him the smallest nod, and he returned it with the fractional precision of a salute that wasn't quite a salute, and neither of them made anything more of it than that. The surgery took 2 hours. Devlin went up at 4:15 and came back down at 6:20, intubated and sedated, with a repair to the intercostal artery and a chest that was, according to Dr. Osei, cleaner than she'd expected given the mechanism. She said this to Tate specifically, in the hallway, with the undemonstrative approval that Tate had learned was as close to warmth as trauma surgeons generally got. "He'll probably make full recovery," Osei said, "barring complications." "Good," Tate said. Osei looked at her for a moment with sharp, assessing eyes. "Where'd you train?" "Fort Bragg, initially, then various places." Osei nodded. It was the nod of someone who recognized a non-answer and respected the person giving it enough not to push. "Good work tonight," she said, and walked away. Cardozo was in the family waiting area with the other soldier, shorter, younger, named Tate Breru, when Tate found them at 6:40. The waiting room was empty at this hour except for them and a man in the corner who had fallen asleep in his coat. Cardozo looked up when she came in. His face was exhausted, the particular exhaustion that came from hours of controlled adrenaline finally releasing its grip. "He's out of surgery," Tate said. "Stable. ICU for a few days, then recovery. They expect full function." Brower let out a long, slow breath and pressed both hands over his face. Cardozo stood. He was a big man, and standing, he was very aware of how big he was. He did that thing that large people with good instincts did, pulling his presence in slightly, making it smaller than his body. "Thank you, Sergeant." She paused. "I go by Tate here." "I know." He looked at her steadily. "How long have you been out?" 16 months. He nodded. Something crossed his face that she recognized. Not pity, not admiration, just acknowledgement. The simple recognition of one person who understood a particular kind of life for another. "Is it?" He stopped. "It's fine," she said. "It's a good place to be useful." He looked like he wasn't entirely sure he believed her. She wasn't entirely sure she did either, and she wondered briefly if that was visible. "He asked for you," Cardozo said, "before they took him up. He was pretty out of it, but he asked who placed the tube. Nurse told him. He doesn't need to know anything else." "No," Cardozo agreed, "he doesn't." She left them there and walked back to the nursing station. The day shift was starting to filter in. Fresh scrubs, coffee cups, the bright morning energy of people who had slept. Jordan was doing her end-of-shift charting. The monitors beeped. The fluorescent lights hummed their single flat note. Forsyth's office door was closed. She sat down at the charting station and pulled up her notes. The rooftop procedure needed documentation. The tube placement. The pre-surgical assessment. She typed it the way she did everything. Precisely, without commentary, in the language of observable facts. She was most of the way through when Ewan appeared at her elbow. He stood there for a moment without speaking, which was unusual for him. "Administration is going to want a meeting," he said finally, "about last night." "I know." Forsyth filed a report. "I know." Nguyen was quiet. She could feel him thinking. "For what it's worth," he said, "I saw the pulse ox on that roof. I saw where it was and where it went." She didn't respond. "I'm just saying." He picked up a chart from the rack beside her. "Spell your name right on the documentation. They'll want everything clean." She watched him walk away. The morning shift nurse who was taking over her patient load appeared at her shoulder with a gentle, apologetic look, and Tate gave her the most thorough handoff of the night because that was what she did. And then she gathered her jacket and her bag and walked out through the ambulance bay doors into the cold gray morning. The parking lot was half empty. Her car was where she'd left it, the oldest vehicle in the lot by a decade, with a dent in the rear quarter-pound that she'd been meaning to get fixed and kept not getting fixed. She sat in the driver's seat for a moment without starting it. The decompression always took a while. Her hands on the steering wheel, the quiet of the car, the slow recalibration from the particular frequency of the ER back to whatever frequency ordinary life operated on. She was still working on that recalibration. 16 months in, she was still learning the distance. She thought about Devlin's face on the litter. She thought about the hiss of the needle. She thought about Forsyth's expression in the hallway. And she thought about what Nguyen had said. And she thought about Jordan asking her how she stayed calm. Practice, she'd said. It was true, as far as it went. It just wasn't the whole truth. The whole truth was more complicated and more private, and not something she owed anybody, not even the people who were going to sit across a conference table from her in a few days and ask her to account for herself. She started the car. The sky over Dayton was beginning to lighten at the edges, the darkness thinning from black to a deep, granular gray. She pulled out of the lot and onto the empty road, her headlights cutting a clean path through the last of the night. She'd go home. She'd sleep. She'd come back tomorrow and do it again. Whatever they decided in that meeting, whatever Forsyth filed and administration reviewed and the board concluded, she had been where she was needed, and she had done what she knew how to do, and a 26-year-old man was breathing in an ICU bed instead of a body bag. They could decide what to do with that. She already knew. I keep thinking about the moment Tate stood on that rooftop with a 14-gauge needle in her hand and a man's life running out by the second. She didn't announce herself. She didn't explain her credentials or ask for permission or wait for the room to catch up to what she already knew. She just acted, with the kind of precision that doesn't come from reading a textbook, but from carrying it in your hands through years of places most people will never go. That's what I can't stop sitting with. The idea that the most capable person in that building had been treated like she was barely keeping up. Forsyth called her slow. He called her disengaged. He built a whole story about who she was, based on the fact that she didn't perform her competence loudly enough for him to recognize it. And I think most of us have been on one side of that equation or the other, either dismissed by someone who couldn't see us clearly or, if we're honest, doing the dismissing ourselves. What Tate understood, and what Forsyth didn't, is that real integrity doesn't need an audience. She restored that blown IV in Bay 6 because a patient needed it, not because anyone was watching or keeping score. She repositioned that elderly man because it was the right thing to do, not because it would show up on her performance review. That kind of moral consistency, doing the right thing whether or not it benefits you, whether or not it gets noticed, is rare, and it's the thing that held her together through all the small daily indignities of being underestimated. But integrity alone doesn't save lives on a rooftop in the dark. That takes something else. It takes the kind of knowledge that's been pressure tested until it becomes reflex, the breath sounds she interpreted in seconds, the landmarks she found without hesitation, the decisions she made while Forsyth was still formulating the question. 9 years of hard-earned understanding that lived in her hands as much as her mind. I think about how many hours of work go into that kind of clarity, and how invisible all of it is until the moment it matters most. And then there's the part of her story that I find hardest to sit with, and also the most honest. She kept showing up, after every sideways comment from Forsyth, after Nguyen delivered his careful diplomatic warnings, after being treated like someone who needed to prove herself in a room where she was already, quietly, more prepared than anyone else. She didn't leave. She didn't harden into bitterness. She just kept doing the work. That kind of persistence isn't stubbornness. It's the decision, made over and over again, to stay useful in spite of everything that's trying to make you feel small. I don't think Tate would describe herself as particularly heroic. I think she'd say she was just someone who knew what to do and did it. But that's exactly the point. The people who show up when everything is falling apart aren't usually the ones who've been loudest about their capabilities. They're the ones who've been quietly building them for years in circumstances nobody in that hospital could imagine. The rooftop didn't reveal who Tate was. It just finally made it impossible to look away.